Hello, this is Dr. Gay from First Lake MRI, and this is a 15-year-old male who flipped a golf cart, injured their shoulder, and they have something that we call a HAGL, H-A-G-L, humeral avulsion of the glenohumeral ligament, HAGL lesion. And this is an acronym for a tear of the inferior glenohumeral ligament, which is here, torn from the humerus. So it has an attachment to the glenoid, and on the lateral side it has attachment to the humerus. So this is a humeral avulsion. We see the inferior glenohumeral ligament and inferior joint capsule. The inferior joint capsule is the central part, and the inferior glenohumeral ligaments are the front and back portions that are thickened. You really can't tell them apart typically. You just see this one band, and along the front you say, well, it's a little bit thick there, I'll call that the anterior band. And along the back, maybe this is a little thick, I'll call it the posterior band. But really, it's just this broad band, the joint capsule, with areas of thickening. And when that is torn from the humerus, we have fluid that can track down like here along the humeral shaft, and you see the inferior portion floating in the breeze here. Of course, this can tear from the glenoid side. We see that even more commonly, but this is again called a HAGL, HAGL lesion, humeral avulsion, meaning avulsion from the lateral side, humeral avulsion of the inferior glenohumeral ligament. Just another image of that. The patient also had a non-displaced fracture or stress injury with a greater tuberosity, some partial tearing of the rotator cuff attachments up here, and here's that inferior joint capsule, inferior glenohumeral ligaments. This is about the end of it right here. This is the coronal sequence. We see the inferior part of the joint here looking very irregular. This is that inferior joint capsule, and then in the inferior glenohumeral ligaments, the posterior and anterior band somewhere in here, but you can see there's thickened and poorly defined, ruptured, complex fluid in the axillary pouch. This patient also had a tear of their subscapularis tendon. This is the subscapularis muscle here, and the tendon was torn and poorly defined here at the attachment to the lesser tuberosity. So severe injury, and thank you very much.